This mother and her child in rural Malawi traveled for hours to get tested for HIV, the human immunodeficiency virus that causes AIDS. Specialists in the field say that in many African and Asian countries, the critically important testing and diagnosis of deadly infections such as HIV, syphilis or hepatitis is often more difficult than delivering treatment. To improve public access to medical testing, the Government of India recently deployed a small fleet of mobile health labs to several remote parts of the country to enable people there to be tested for HIV and other diseases.
These are mainly meant for actually to reach the arrive at the outreach areas where people cannot come or attend the standalone ICTCs, and the people there. The people, vulnerable people and the suspected people will be tested for suspected HIV AIDS.
SP Bandopadhyay was involved in planning the campaign. He and other public health officials say these mobile centers have not only improved the diagnosis of disease but also helped target treatment efforts in remote communities. Medical testing for these underserved populations could get a major boost from the tiny new mobile microfluid chip, also called the M-chip. It's the brainchild of Dr. Samuel Sia of Columbia University in New York, who says his lab on a chip can diagnose HIV and syphilis infections in 20 minutes with just a tiny drop of blood.
The way that this chip works is that we have miniaturized, very complicated laboratory tests into something that you can hold in your hand, really the size of a credit card.
The M-chip uses an existing technique for blood sample testing called lateral flow technology. But Dr. Sia says his device is unique in being able to detect multiple or co-infections simultaneously, such as HIV and syphilis.
Each of the areas on this card, there's little squares here. Each one can detect a different disease. And so what we're trying to do is to really leverage that ability and to detect multiple diseases in one card. We can probably detect 5 to 10 without too much problem.
Dr. Sia says the single-use plastic testing card has many other advantages over a conventional lab. It costs only $1, and because it's disposable, it avoids cross-contamination of patient samples, and it's reliable. When the M-chip was tested in Rwanda recently, it was 100% accurate in detecting HIV and 94% accurate in detecting syphilis. Sia believes this speedier and more reliable testing will be crucial in poorer countries where undiagnosed infections cause high rates of maternal and infant mortality. And he says the M-chip could also help lower health costs throughout the developing world. Vidushi Sinha, VOA News, Washington.